Hey everybody, clearly I've been a major slacker and I've taken a lot of time to get to this, but I wanted to relaunch my YouTube page and actually going to kind of do a little bit of rebranding, which I can explain a little bit. I'm working from my kind of my extra room in my house. It's kind of a studio room, not too much to get distracted with in here. Anywho, the reason I want to kind of rebrand and relaunch, well, for one, because the old website was kind of very amateurish, and not that it still won't be, but hopefully we could do a little bit better. But so mindfulness will still be a big part of this, but I want to expand a little bit. I want to get more into what I'm consider to be called mind-body medicine, learning more about and hoping to start treating more psychophysiologic disorders. It's this based out of the work of Dr. Howard Schubner, and which was based a lot on the work of Dr. John Sarno. And so people who don't know about that, you could learn more about that hopefully by watching this. I'm trying to get more into it. I was very lucky to do a weekend training with Dr. Schubner and Alan Gordon, who's a therapist who works really closely with him, and they're doing a lot of exciting research out in Colorado right now and all around the country. So either way, I wanted to expand a little bit just from just mindfulness, as well as the fact that mindfulness is just becoming such a big, craze right now. It's kind of the in thing, and then you see magazine covers like on Time magazine and Mindfulness magazine and other things devoted to this, which are great, but I want to move a little bit beyond that. I think there's more to it, and we could talk more about some of those things, and hopefully we can expand the demographic that appeals to as well. With that said, I don't need to say too much more about that, but I do want to get back to some basics. I would like to start off with discussing or actually leading a body scan meditation. There are multiple reasons I would like to start with that. For one, if you ever do a mindfulness-based stress reduction course, that's actually the foundation. It's the beginning. We tend to start with a body scan, and I actually find that it's extremely helpful for many things. I found it very helpful for insomnia, and I've treated patients with that. No medications or pills, but actually just body scan meditation, and had success. I had personally had success with that. Also, I found it profoundly helpful for anxiety, as well as muscle tension. Connecting the mind to the body. Muscle tension can be a big trigger for migraine headaches, tension headaches, and also just being more aware of your body. You might catch yourself earlier in stress reactions, and instead of going into a full-blown reaction, you can actually respond to stress as opposed to reacting to it. So I think it's a good place to start. So I was calling, obviously this page has been called, well, obviously to the 3 or 4 followers or subscribers that I have, this page was called Jean Mindfulness How, or Dr. Jean Mindfulness How, something like that. I don't even remember. And I had created this intro for that. It's not that good looking, kind of cheesy. So I think I want to expand. I want to maybe change the page name, or I think I'll change the page name to Mind Body Medicine with Dr. Howell. I think that'll expand things a little bit more. We could focus. Mindfulness will still be pretty central and important, but I think take it I don't know if a few steps further, or expand that a little bit, and we may be able to help people with, or at least help people get in the right direction to have help with many disorders that I think are very treatable through mind-body approach. Everything from depression, anxiety, chronic pain, chronic fatigue, among many other things. So pretty powerful, pretty cool, very science-based, and I think a lot of good evidence for some major improvements in treatment for patients in those areas. And I'm becoming passionate about that. I'd like to talk about that more. So thank you so much for watching. And like I said, today we will start with a body scan meditation. So please, anybody who needs help just becoming more present with their breath and their body, as well as difficulties with sleeping or headaches or anything like that, John Kabat-Zinn has this really interesting quote in his book where he says, in a society that's so obsessed with our physical bodies, it's amazing how out of touch we are at the same time with our own bodies. And it's very true. So I think this is a good place to start, and please enjoy. A good position to do this practice in is lying down on a carpeted floor or a mat of some sort, such as a yoga mat. You can do this lying in bed, however. You do run the risk of falling asleep, and the point of this practice is to wake up and become more aware as opposed to falling asleep, so just be aware of that. Remembering that the intention of this practice is to become more connected to this mind and this body, and just really settle in a mindful way. Remembering, I've talked about this being useful for, sometimes people find it calming and reducing anxiety and helping with insomnia and these things. However, there are a few attitudes that you should approach mindful practices with, and some of those include non-judgment, letting go of the liking or disliking of things, and also equally important, non-striving, letting go of this way of thinking of always trying to get somewhere, that we're practicing this so we'll become this or that. And actually, this is all about just being present with things as they are. And although you may gain some of these benefits that we discussed before, you're more likely to attain that if you let go of the trying so hard. It's kind of like when you're trying to find your keys and you can't find them. You find them when you're not actually looking for them anymore. So lying down, and at first just taking the first few moments to focus in and bring awareness to the physical sensations of the breath, of breathing. We're not thinking about the breath. Perhaps it works best to find out where you feel the breath most prominently. Sometimes it's feeling the belly expand and rise with the in-breath, feeling it deflate or fall with the out-breath. Or perhaps you feel the air at the tip of the nose coming in with the in-breath, and leaving the mouth or the nose with the out-breath. Breathing in and knowing that you are breathing in. Breathing out and knowing that you are breathing out. You may find that from time to time, your mind has wandered off from the breath onto a thought, an emotion, whatever it may be. And once you have recognized that, notice that you're already back in the present moment. And without judgment or feeling bad about it or feeling like you're bad at meditation, just gently, with compassion, note that and come back to the physical sensations of breathing. Seeing if you could stick with the in-breath for the entire in-breath and the out-breath for the entire out-breath. noting how the breath comes and goes, just like the waves in the ocean, the clouds in the sky, the impermanent nature of breathing. And now that we have arrived and we are centered, moving on to the body scan meditation, shifting your awareness down to the left foot, perhaps starting at the point of contact with the ground. Perhaps it's the bottom of the foot if you've chosen to sit, or the back of the heel and the side of the foot. Just noting what it feels like, what sensations you have. In the field of sensations, there are many. There are itches, aches, tingles, numbness, warmth, coolness, pain, lack of any sensation. All of these tend to fall into one category or another, such as pleasant sensations and unpleasant sensations, or just neutral sensations. But remembering to have a non-judgmental awareness and just note it for what it is, letting go of the liking or disliking, the wanting to push away or the wanting to pull towards, just noting whatever sensations you may be feeling. The bottom of the foot, the top of the foot, the toes and between the toes. Moving up to the left ankle, the back of the ankle and the Achilles tendon, the sides, the outer envelope in the skin, seeing if you could sense into the deeper structures, the bones and cartilage and ligaments, the joint itself. Moving up to the left lower leg, calf, the shin. This whole space between the left knee and the left ankle. Noting that as you do this body scan, not only do physical sensations arise, but perhaps some parts of the body might evoke emotions and thoughts, and just noting what comes up, watching it all with the curiosity of a scientist in deep observation, and just being present with those things. Moving up to the left knee, this joint that carries the weight of your body, if you do have the ability to walk, and a place where many of us have experienced aches and pains at times. The outer skin, deeper into the kneecap and the bones and the joint ligaments and fluids, just noting whatever sensations you become aware of. Shifting up to the left upper leg, the powerful muscles of the thigh and the hamstring and the back of the leg. Noting the sides of the leg. Bringing non-judgmental awareness to whatever you may be feeling. Perhaps noting, just like the breath, sensations too come and go and have an impermanent nature. Shifting gently and slowly, if you feel ready, up to the left hip joint. This joint that connects the leg to the body, the pelvis region. Noting any sensations you might feel there. Then allowing the left leg to drift off away from your awareness and shifting down to the right foot. Once again, starting at the point of contact with the ground and just noticing what that pressure feels like. Working your way along the bottom of the foot, side of the foot, the toes, in between the toes, the top of the foot. Noticing whatever sensations are present. Working our way up to the ankle, the Achilles tendon in the back, this cord-like structure. Skin around the ankle and deeper structures, whatever you can sense into. Moving up into the lower leg, the calf, the shin, the outer envelope, the skin. Shifting your awareness up to the right knee. If at any point during this meditation you find yourself lost on a thought, just like before, perhaps you can label it as a thought, planning. Once you're aware, you're already back to the present moment, and without judgment, without feeling bad about it, bring your senses and awareness right back to the sensations of the body scan meditation. Moving up from the right knee up into the upper leg between the knee and the hip. Front of the leg and the back of the leg, the outside of the leg and the inside of the leg. Even if at any point you don't detect any sensation, just being present with that and what that feels like. Slowly and gently moving our awareness into the right hip. This large joint that connects our leg to our bodies. Just noting anything we might be feeling there. and bringing the entire lower part of the body, both legs and feet and toes, and sensing into the lower half of the body all at the same time for a few moments here. And then gently allowing that to fade away from our awareness off into space somewhere and shifting to the pelvis region. This region that houses the organs of reproduction and elimination. Noting anything we feel in this place. Letting go of any ideas or judgment about these things. And just noticing whatever arises, whatever sensations are present, and also whatever thoughts or emotions may arise. And just bringing awareness. Gently moving up the front of the body to the belly, the abdomen, the organs of digestion and assimilation rest, and noting any sensations that are present here. Perhaps you can feel the belly rise with the in-breath and fall with the out-breath. This is an area of the body where often people experience sensations when they have deep emotions or stress. Just noticing whatever arises without judgment, without thinking about it, and just experience it. See what it is. When you're ready, shifting around the sides of the body to the lower back. This region of the body that many people have experienced pain, sometimes for years, sometimes here and there, and sometimes daily. Starting at the very low part of the back, and slowly and gently shifting the awareness from one part of the low back to the next level, and the direction of the upper back. If any pain is present at this time, perhaps just shining the spotlight of awareness on it without judgment and just noticing its characteristics. Letting go of the wanting it to be gone, the wanting to push it away, and just notice, what is it? What is that sensation? What's the shape of it? Does it have any other characteristics? Just noticing what's there. Noticing any emotions that arise. And when thoughts do arise of wanting it to be gone or whatever, just recognize those and label those as judgments and let them go do their own thing. Don't feel bad about that. Just don't get caught up in it and come back to non-judgmental awareness. Gently working your way up the back. Noticing how each spot feels and what sensations have arisen. If at any point during this meditation you need to spend a little bit more time on a particular region, whatever serves, whatever is best for you in this moment, that is okay. And if you're ready to move on along with this guided meditation that I'm guiding right now, then that's fine too. At this point, perhaps noting the sensations between the shoulder blades and the back of the upper back, and just noting whatever sensations are in this region, if you've made it there. Wrapping around to the chest region, just above the abdomen in front of the body. Noting whatever sensations you feel there. Starting off in the skin in the front of the chest, gently going deeper into the tissue just beneath the skin, down into breast tissue, noting any sensations, emotions, or thoughts that arise. Moving down into the muscle, the sternum and ribs, down to the lungs and the heart. If you can feel any sensations of the heart beatings, experience that. Otherwise, just experience whatever it is that arises. Perhaps the expanding of the chest wall with the in-breath. Shifting down into the fingers of the left hand and just noticing any sensations there. Moving gently up to the knuckles, these joints that attach the fingers to the hand. The back of the hand, the palm of the hand. Shifting up into the wrist, moving up to the forearm, up into the left elbow, the upper arm, the large muscle in front, this biceps muscle, the triceps muscles in the back, the skin around it all, the bone that's deep in there. Noticing any sensations. Moving up to the left shoulder. And shifting down to the fingers of the right hand. Thumb, the pointer finger, just moving from one finger to the next and between the fingers. The knuckles again, and the back of the hand and the front, the palm of the hand. Moving up into the wrists. Up into the forearm. The elbow. And the upper arm. Just noting whatever arises. Shifting up into the right shoulder. And once again, this whole upper back shoulder region between the shoulder blades, from shoulder to shoulder, just noting anything we sense up here. Often a place where many of us hold quite a bit of muscle tension, these large muscles just on top of the shoulders. Noticing if you're holding any unnecessary tension and seeing if with the out breath you can kind of let go and just only what's necessary as we lie here on the ground, being present with our mind and our body. Gently moving up to the neck, much like the back, just moving up a little bit at a time and noticing any sensations or whatever arises there. Gently moving up until we get to the point where the neck connects to the back of the skull, wrapping around to the jaw. This joint that's responsible for so much of what we do, talking, chewing, perhaps grinding our teeth there in times of stress. Noting whatever we feel or notice in these powerful muscle and joint. The skin that envelops it. And gently moving to the front and the chin and perhaps the lips and the rest of the facial structures, noting anything we notice there. Letting go of any need to make any facial expressions. Letting the muscles just be. And no need to hold any extra tension. Just noticing what things are like there. Around the eyes and the forehead, the cheeks, the nose and the lips. Shifting awareness into the mouth teeth, tongue, the mucosa on the inside of the cheeks and around the palate, back of the throat. Shifting up to the top of the head, the back, the sides, the ears, noticing any sensations, thoughts or emotions that arise. And then seeing if we could envelop the whole body in awareness, just from head to toe, perhaps starting at the head, face, mouth, the neck, shoulders, arms, the chest, the upper back, the abdomen and the lower back, the pelvis, hips, upper legs, the knees, the lower legs, the ankles, and the feet, and just experiencing the whole body at once in wholeness. And then gently simplifying things and coming back to just the sensations of breathing for a few moments. Breathing in and knowing that you're breathing in. Breathing out and knowing that you're breathing out. Taking a few moments before we bring this body scan meditation to a close, and perhaps extending some gratitude towards ourselves for taking this time to nurture ourselves and just to be present with our body and mind in a way we often aren't. This is truly an act of love and kindness, and will help you to be able to spread those things and calmness out towards the people around us as well. May you be at peace. May all beings be at peace. Now gently opening our eyes, wiggling our fingers and our toes and stretching out and transitioning back to the rest of our day.